All right, so today I'm going to be talking about this book, The Whole Brain Child. The authors are Dan Siegel and Tina Payne Bryson. Dan Siegel is a child psychiatrist from UCLA. I was very fortunate that he was at the university when I was there. He gave a lot of wonderful lectures. He didn't directly teach us when we were in child fellowship, but his presence was definitely known. And Tina Payne Bryson is a clinical psychologist here in Los Angeles who's got an amazing practice. And she wrote a lot of this book as well and helped him. She trained with him. So this book is great because it really helps us as parents to think about the ways that we can help our kids integrate their experiences with an understanding of the neuroscience of their brain. I'm Dr. Marissa Caudill. You can find out more about me at theparentdoctor.com. I do this book club every month. Some announcements for this month. I started a podcast. It's called the Parent Doctor Podcast. You can find it on all the places where podcasts are, at least most of them, Apple, Spotify. I think it's on Audible too. Google. And starting next month, I'm going to be having a subscription service that will be paid, but it'll be a low monthly fee to be meeting with me twice a month, not as your child psychiatrist or your child's psychiatrist, but as a child psychiatrist who's available to you to answer any questions that you have about parenting, about kids' mental health, about assessments, all of that kind of stuff. If you want to learn more about that, you can get on my newsletter by going to my website and you'll get emails about it in the coming weeks. All right. So this is the logo to look for when you're looking for the podcast. Starting out, this book is really about integration. That's the theme that comes up over and over. How can we help our kids integrate their emotional experiences with their logical experience? How can we help them integrate their right brain? And they talk about how toddlers and babies are really right brain dominant, meaning they're very emotional. They don't have language. They just have impulses and emotions. And that's where our creative brain is, right? That's just very connected to who we are and what we're feeling. The left brain, on the other hand, is more language driven, more thoughtful, more logical, and that develops over time. Then in addition, there's kind of the upstairs brain and the downstairs brain. Other people call this the wizard brain or the lizard brain. Your upstairs brain is your prefrontal cortex. This is the most evolutionarily advanced part of your brain. This is the part of our brain that can really help us think about what it's like to be in someone else's shoes. Therefore, it's the part of our brain connected to empathy and apologizing and all of that stuff. The downstairs brain's job is the most important job of your brain, which is to keep you alive. So it's tasked to keep you surviving, and that's a very important job. It's on guard. And as a result, it is likely to trigger even when it shouldn't. And then you have to kind of recover from that. And we're all familiar with that as adults, but it happens more for children. And our job as parents is to kind of help them integrate the upper part and the lower part of their brain, as well as the left side and the right side. Excuse me, I've got a little cold today, guys, so my voice is kind of scratchy. So I love Dan Siegel because he has all these like clever ways of helping us remember things, like acronyms that I actually can remember. Usually I can't remember acronyms, but his stick with me. And he also has a lot of great visual analogies, which are helpful. One of the things he talks about in the book is helping kids SIFT, S-I-F-T. And this stands for thinking about sensations. What is your body feeling? So if your kid's having a big emotional response to something, rather than telling them what they're feeling or trying to get them to label it, you can just ask them, like, what are you feeling? What does that do? Well, it gets them to connect the left and right sides of the brain and the upstairs, downstairs parts of the brain, because they need to add words to the sensation or the emotion. Then you can ask them, what do they see? What do they imagine? You can ask them what they're feeling. And you can let them know that feelings are temporary. Most emotions only last about 90 seconds. And then you can help them identify the thoughts that are going through their mind. You might not be able to do this all at once, and you might not be able to do it in the moment with your child, especially if they're having intense emotions, but it's a helpful acronym to use after the fact, once the big emotion has passed, to help them really think about what was happening in their mind and in their body and help them realize why they responded the way that they did. Other people use similar techniques. Like I said, there's people who talk about the wizard brain versus the lizard brain. There's a psychologist named Julia Caldwell, and she has something called the SO technique. This is very similar, right? It stands for sensation, emotion, and want. So when you, as an adult, are struggling with a strong emotion, she encourages us to think about, what are we feeling? Like, kind of take an assessment in your body. What is it that you're feeling? What's the emotion? So maybe you have like stomach ache or tightness in your chest or tension in your shoulders. What's the emotion? Like, I'm feeling unappreciated, or I'm feeling distressed. And what is it that you want? If you can describe to someone, a family member, a friend, like, I'm feeling this in my body, I'm feeling distressed, I want this, it's much less likely to trigger them to be defensive with you than it would be if you just say like, why don't you help me unload the dishwasher? You're always so lazy. You expect me to do everything for you. If instead of that, you can just say like, oh, I'm feeling kind of like tense in my shoulders. I'm feeling a little overwhelmed. Could you help me with this kitchen cleanup, please? You're much more likely to get your partner to help you out. And I think that's something we can teach our kids as well by modeling. Okay, the next part of his book, he talks about, well, I don't know if it's actually the next, like linearly in the book, but he talks about this thing called the wheel of awareness. This is one of those visual analogies that I really, really like. Essentially, the idea is kind of common to Eastern medicine, common to meditative practices. The idea of coming back to your central hub is very similar to getting to a place of conscious awareness. So he imagines a bicycle wheel and how you have the spokes all along going to the rim, and that the whole rim is all the emotional experiences that you can have. And if you've never seen the feelings wheel, I'll give that to you in this week's PDF for the book. But basically, we have a whole range of emotions that we can experience as human beings. But most of us tend to experience just a handful over and over again because they become familiar and they become kind of our emotional home, our default. And what he encourages us to do is talk to our kids about this, that we sit generally in one or two spokes on the rim, but if we can come back to the hub, it's easier then to see all the places we could go and turn our attention and make a different choice. So from the center, from central awareness, conscious awareness, the hub of the wheel of awareness, we can think about a different emotion that we want to experience, and we can choose that. So it's kind of a practice of mindfulness, but a very nice visual analogy that I think most kids can also grasp. Again, another thing he has is these nice little things like connect and redirect, name it to tame it, like all these like easy to remember mnemonics. So connect and redirect is really about when our child is distressed, we first want to connect with them with our right brain to their right brain. We want emotionally to help them feel heard and understood. And this is what Stephen Covey talks about as like level 5 listening. Don't just try to understand what they're saying, but try to get to the emotion behind it. What does that do? It gives them felt safety. It helps them feel secure and safe in your presence. Once they've got that, once you have that bond with them, that's when you can then appeal to their left brain or their upstairs brain to stimulate problem solving and perspective taking. I got all these images, by the way, from ChatGPT. They get funnier as we go along, so wait for them. The next is engage, don't enrage. So very similar, right? Like for us, when our kids are distressed, it often causes us to be distressed too. We need to be able to take a moment to not be so reactive. First, soothe their downstairs brain, give them that felt safety and our own, right? Because we have to be in a calm place to be able to do that for them. And then appeal to their upstairs brain to stimulate the problem solving and perspective. They're basically very similar approaches. The idea is that when our kids are distressed, it can lead us to feel distressed and we might want to just yell in response or tell them that's not okay. But it's much more beneficial if we can practice connecting with them first where they're at, not in the extreme of gentle parenting that's made fun of with memes all over the web, where the mom's like lying on the floor for 4 hours with her kid talking about their feelings. We don't have to go to that extreme. But first, just letting your kid know that's really frustrating. I can appreciate that that's making you feel upset, like that their feelings are valid, right? But we also don't want to encourage them to wallow in those negative feelings. That's where that wheel of awareness is really important. We want to empower them to realize even when we're feeling crappy, even when we're feeling a difficult negative emotion, we can come back to the hub and make a different choice, have a different perspective. But that requires some degree of left brain or upstairs brain involvement. Okay, this is where the ChatGPT Dolly images get funny because they can do such a good job, but somehow with language. Excuse me one second. All right, so one of the parts of the book he suggests is name it to tame it. And this is basically like helping our kids have the language to identify their emotions is really, really helpful. My husband and I are both psychiatrists. I fear we may have overdone this slightly with our children. The other day, my son got in the car and he is like, oh, I was just so frustrated today, Mom. Can I just tell you about it? And he went on for like, not kidding, about 10 minutes straight about all the frustrating things that happened. So I'm glad that he can name his emotions and describe them, but we're still working on the like getting back to the hub and shifting direction piece. It's a work in progress. But again, we want to emphasize to our kids and tell them over and over again, The average emotion lasts 90 seconds. When you're in it, it really feels like it's going to last forever, but it usually doesn't. We also have, I don't know how they measure this, but we have about 60,000 thoughts a day, and 90% of those thoughts are repetitive thoughts. So even though our thoughts can cause us a lot of distress, they're usually not novel thoughts. They're the same crappy thoughts that we have all the time. And 60 to 75% of our thoughts or actions are habitual, meaning we just do them on autopilot. There's a lot of room for improvement here, is my point. With that stepping back into the hub, it's really, really powerful, because even if you can only do it 1% of the time, that's going to increase your chance of having a different thought rather than a repetitive thought, and a different action rather than the same reflexive action. All right. So this was my favorite part of the book. And really, they talk a lot about helping our kids by integrating through storytelling. And for those of you who may have read the book, there's an example that Tina talks about. Well, I read the audiobook, so she's doing that in her voice. I'm not sure in the book which chapter it was, but she talks about a colleague of theirs whose young child, probably around the age of 2, was involved in a car accident where their nanny was driving. The nanny had epilepsy and she had a seizure, and the car crashed. The nanny was okay, but taken away by paramedics, and the child had to wait with the fire department officers until her mom could get there. And they described the kid as just repetitively, being in tears and saying, Fia woo, Fia woo. So Fia was the name of the nanny, and woo woo was represented for this child of the sound the ambulance made when it took her away. And they went together to visit Sophia at the hospital the next day. She was all right. And the mom, over the next few days, just kept repeating to the child when she would say Fia woo woo, or she would say Fia and like make a shaking noise or shaking motion, because she saw that Sophia having the seizure. She would say, yes, you're right. Your babysitter Sophia had a seizure and the car crashed, didn't it? That was scary. And then the ambulance came, took her away, but we visited her in the hospital, remember? And she's okay now. So the mom used language, which I think for many of us, we think that our kids may not have that receptive language at that young age, but often receptive language develops faster than expressive language. So this child was able to take the mother's story about what happened and have it become a memory that's going from implicit and scary and just triggering all of those emotions from the downstairs brain, from the right brain, and having it be more integrated with the logical part of the brain, even though in a 2-year-old, that's a small part of the brain, right? It's really developing. But the language of the mother was really helping this child to integrate that. They later give an example of an older child who put his foot down and really didn't want to go to swim lessons. And the mother was able to say, I hear you saying you really don't want to go to swim lessons. I'm wondering if it might be related to your prior experience with swim lessons. And the kid didn't really remember. She said, well, you may not remember, but when you were 4, there was a really strict teacher. I don't remember the details, but somehow it was like a negative experience that this kid had at the swim lessons. And she's like, I'm wondering if maybe that's why you're feeling a resistance, like that you don't want to go. Like, how would we handle it if the teacher was forcing you to go underwater when you didn't want to? Like, helping the child recognize that they had this experience when they were much younger, when they didn't have the verbal ability to describe it, and giving them the language now to know that they're older and that they're safe and that they can use their words to keep themselves safe, and that helped the child to come around. For me personally, this is really, really poignant. I don't know, for those of you who are on my newsletter list, I wrote a few weeks ago about my own parents, and these stories made me think a lot about my own biological dad. So when he was 3 years old, his parents divorced. It was 1956, and his mom had her dad drive from New Hampshire to San Antonio, Texas, put him in the back of his Chevy, and then he drove with this grandchild he'd never met up to New Hampshire again. And then my dad lived with his maternal grandparents most of his life, and his mom ended up moving back to New Hampshire when he was 15. So from 3 to 15, he was with this different family, with these elderly people. And his grandfather, who was like his dad, just called him boy growing up. They had a very, I think, tightly bonded, but very firm, not that emotionally connected relationship. So when I heard the story about the kid with Fia woo woo, I can only imagine that my poor dad, when he was like 3 years old, would have really benefited from some adult had they been able to help him like integrate the experience he had, which was like he had a mom and dad, and then one day he didn't have them anymore, and nobody really explained to him why that was. And I'm sure it left a big mark on him. So I think when we have our kids going through tough times, even when they're older, it's really helpful to not avoid those topics, but to come back to them and tell the story with them over and over with repetition. And that brings us to, I think, the next slides. So we can help our kids by repeating their stories. And this is essentially the same principle that the therapies for post-traumatic stress disorder are based on. The idea is that with exposure, with repetition of the story, even if it's a tough story, we decrease its emotional valence and its triggering nature. We can let our kids have power when we do this so that they're not overwhelmed. And in the book, they talk about basically telling our kids that they can have like a remote control, just like they can pause a movie or a show. You can tell them like, let me tell you what I remember. And you tell the story and say, if it ever gets too much or you want to skip that part, just tell me pause or fast forward. Maybe they don't want to hear about the bone that stuck out when they broke their leg, but they can talk about the bike ride up until that point. And you can honor that. But the idea is that each time you come back, hopefully they'll let you tell a little bit more of the story until eventually its emotional valence is less. So the main point of the book is remember to remember. Don't assume that negative things that happen in our lives are things we need to sweep under the rug and not discuss. There's actually a lot of power talking about the things that have happened in our lives, even the difficult things for our kids, in a way that helps them feel safe and empowered despite what's happened. And it helps the implicit memories become integrated as explicit memories that aren't overwhelming. Excuse me. Okay, here's another Dolly image that's like, I don't know what this is like. Piggy Hooley hormones. And the idea is that we want to move it to or lose it. So moving our bodies is a stress reducer. Obviously, I mean, I feel like this is kind of obvious, but for kids especially, right? And I think for our modern kids especially, they've cut most recesses really short. My kids are not getting probably nearly enough physical activity. We have a lot of screen time, a lot of TV time, a lot of computer time, a lot of iPad time. And helping our kids remember that moving their bodies is one of the key ways that we cope with stress. So when we're feeling overwhelmed, when we're feeling panicked, when you have high levels of cortisol and adrenaline running through your body, running and getting out is actually very therapeutic. It helps you to not have prolonged stress. And so we can encourage that in our kids too. All right. And then I think we're getting close to the end here, but one of the final things they talk about is just enjoy each other. Like, don't forget to play. And here I wrote, like, what is your emotional home? As I said, on that, feelings wheel that I'll give you in the PDF, or in the idea of the wheel of awareness, we all tend to have certain emotional homes that we go back to again and again. But that's not to say that we can't change those with conscious intention. And I went a couple years ago to a Tony Robbins event, and I was amazed. I'm a psychiatrist, right? I'm a feelings doctor. And he gave us this workbook exercise. We were supposed to write, like, what are like the top 5 emotions that you experience in a given week? And I just had these negative emotions. It was like irritability, overwhelm, fatigue. And I read it and I started laughing. I was like, this is horrible. Like, I need to redo these. But it's very eye-opening and it's very empowering to realize that you really can change those. So do this exercise, and I'll put it in the PDF. Like, think about, what is your emotional home? Where do you tend to go? And for your kids too, you can ask them, like, what emotions do you tend to go to? Some people by nature are very glass half full, optimistic. Some people by nature are the opposite, but we can change that to some degree. And playfulness is a very powerful emotion to think about replacing your negative emotions with, especially when it comes to our kids. Kids respond very, very well to us as parents being playful and lighthearted with them. All right, that's it. How did I do? Oh, perfect. It's only 12:22. I think that's the last slide. Did you guys have any questions? Sorry, I'm trying to get to the chat. If anybody wants to unmute, feel free. Next month, we're going to be talking about the book Brainstorm. It's another Dan Siegel book. This one is one of my favorites because it's about adolescence. It's all about the brain during adolescence. It's got fascinating biology and evolution stuff in there, but it's actually written with the intention that you would read this book as a parent alongside your teenager and read it together. Jessica's asking, is there a point where retelling the story can become damaging? Not really. I mean, I guess it would be damaging if you took it too far. Like if your child's saying pause or fast forward and you're saying, no, we got to talk about this hard part, we have to honor that, like, in the process of retelling, it is to some extent triggering. So we want to push it, we want to encourage the child, but not force them to go to a place of telling the details of the story that's uncomfortable. And we really want to reinforce and honor the fact that it's hard work, and the fact that they're talking about it with you is a good thing. So I think you want to tell the story, but not too much. I think if you're ever in doubt, like if there's a difficult thing, and of course we all know some kids go through really difficult things, right? Like abuse or things like that. Definitely get the guidance of an expert, be doing that with a therapist. But if it's something small, like, you know, your kid fell on their bike and they got a scratch and now they don't want to ride their bike anymore, that would be a good kind of example of something that I think most parents could handle on their own at home. Or like if a dog bit your child, but it wasn't a severe bite, they didn't have to go to the hospital, but it was still scary, you could still talk about that and talk about dogs and talk about kind of gradually exposing them to dogs again and how to be safe in the future. Did that answer your question, Jessica? I think the whole point is just like, we don't want to be afraid to talk about even difficult things. And even when it comes to difficult things like abuse, there too, like when you're working with kids in that situation, you don't not go there. The therapy does go there to all the details, but you do it in a way that's very respectful of the child, leading the way and telling you when they feel ready to tell the whole story. You don't want to force it too much. They have to be the ones who are really in the driver's seat. All right, so for brainstorm, that'll be next month on third Wednesday of June is the 19th of June. And it's a red book. The cover is red if you're looking for it at the bookstore or at the library. And it's a pretty quick read, as I recall. It was a few years ago that I read it. I'm going to be rereading it to be ready to present it to all of you. But I think it's really unique because I don't know any other books that have been written really with the intention that a teen and their parent would read it together to better understand what's going on in the teenager's brain. And I think that would have been very helpful for myself as a teenager to kind of think that through and talk about my experiences with my parents. Most teenagers, I think, just go through the experience of their parents not understanding them or feeling that they don't understand them very well. And it was helpful for me, I remember when I read it, to recall a lot of the things that he discusses happen in adolescence, because most of us, I think, kind of have this amnesia about our own adolescence. We don't remember all the crazy, stupid things that we did, but he somehow elicits that in your memory in a very nice way. Well, thank you all so much for joining. I will see you next week, or sorry, next month. And if any of you want to download my podcast, please do. And if you can review it, that helps it boost up the rankings and gets it out more. Season 1 is all about the top 10 reasons people have brought their kids to see me, a child psychiatrist, about like anxiety, depression, behavioral problems, vaping, that kind of stuff. Season 2 is going to be audience suggestions. So please email me, hello@theparentdoctor, or put a comment on the website if there's any topics that you would like me to discuss in future podcast episodes. Take care. Bye.
Thank you. Bye.